just utilization. And then some people, there's a handful of applications that provide hypnotherapy. That to me is really kind of scary, that I would be sitting someplace and hypnotizing myself with an application, and then, who's supposed to snap me out of it? So, obviously these are unregulated, and there's no way to really confirm or make these applications developers adhere to clinical standards, because they're just software programmers in a cubicle somewhere. There's other types of reasons that people use these, but another one, and again towards the bottom you can see the utilization is much, much lower, is for affirmations. And this is where I think that clinicians can begin to gain some value, is in affirming what the person is doing is good and right and just, and supporting them and coaching them. The lowest usage that you can see there on the screen is for reference, and this is information on therapy and references towards therapy and referral. Unfortunately, I think this whole graph should just be flipped around, and it would be nice if the greatest use of the application were in affirmations and getting people to the right therapy and the right intervention. If you look at the cost of these things, obviously they don't cost a lot, but again, hypnotherapy and affirmations, probably the excuse me, easiest ones to write, are the most expensive. And then when you look at the new types of applications that were launched in that 6-month period of time, you can see that the greatest group still is in that tracker. How many times today did I smoke? We know from the diet industry, particularly Weight Watchers and some of the other diets, that if you write down what you eat, you're more likely to be successful in a diet, because you can see what you're eating, as opposed to just eating and thinking that you only ate X calories. This may be the success and the interest in using the tracker, is that people need to be able to mark down how many times they smoked and actually look at that. So when you think about motivating patients that are in this category to use smartphone health applications, what we know from about the last 3 to 4 years is that patients who use smartphone applications have a high rate of dropout. And about a quarter of them are only using the application once. So they buy it and they only use it one time. And most of them, 3/4 of people, will discontinue using the application altogether by the 10th use. This is one of the reasons I resisted to getting a smartphone. Is I'm not sure about these statistics. What we know is the Consumer Health Information Corporation looked at gauging consumer interest in health apps and evaluated how likely people were to adhere to them. And really what we found is about 80% of respondents preferred that the application that they would be using would analyze health information they were logging and give them feedback on that. So they're really looking for that more of an intuitive application, and then one that will guide them, give them that feedback, and tell them what the next step is. So we're understanding a little bit more about health apps and how to use them successfully as adherence tools, and these are going to become increasingly more important in the work that you do. They need to be practical, easy to use, and follow evidence-based guidelines. And we know they're not there yet. However, in your work, particularly in smoking cessation, in obesity, for calculating or tracking how much I ate, there are applications out there that are those tracker-based applications that would be effective and successful. So an effective outreach program through telehealth for the services that you're provided really is a collaboration through primary care. Anytime you can link up with primary care and help establish a triage and referral process, so that when those individuals are in the office, they can get to you while they're there or at a convenient time for them, is really going to be one of the effective ways to use telehealth in an outreach capacity. I would encourage everybody, and I know this is difficult in some schedules, but to have an on-demand service available. What we've seen on the medical side is anytime we say If you have a patient in the office or you have a client in the office who needs another service and we can provide that right then, the likelihood of that patient getting that service and being compliant with the service is much higher. And so that's why we sort of are looking in our smoking cessation program of seeing how we can create an on-demand service so that Deb Cron and her colleagues are immediately available to work with someone when they tell the primary care clinician, yes, I'm ready to stop smoking. Find all the different ways we talked about today to use the virtual space effectively, to leverage yourself without physically moving from where you are. That's one of the most effective outreach strategies you're going to have. And it's really about leveraging yourself as a resource in a new way. Anytime you're thinking about going out and doing some work in an outreach, physical outreach, consider whether or not you can use that computer or a smartphone application to work with that individual and be available at the time that they need you, rather than every Tuesday because you had to drive out there for clinic. And when you think about leveraging yourself as a resource in a new way, you know, think of telehealth as a new automobile. It's a new way for you to do outreach. Create asynchronous methods of communicating and supporting your clients. Again, through web portals, through logs, through chat rooms, again, different ways where they can connect with you, but maybe not at the same time that you're available. Use the technology as effectively as any of our other online enterprises do. We order all kinds of things on the internet. We do all our banking over the internet. We order groceries. There shouldn't be any reason why I can't leave you a message and ask you for help, and I can get that back asynchronously as well. Anytime you stay put, you're going to be able to do more and reach more people. Here's one of the interesting things that we did at Marshfield Clinic in the last couple of months. As you know, Farm Progress Days, I think they're called Farm Technology Days now, was in Marshfield this year. It's the largest international farm exhibit in the world. There were people there from Australia and Europe and Great Britain and all over the United States. But if you notice, and I hope Deb's on the line, if you notice, we set up a telehealth system in the tent there in our little booth, and we had a line put in, and one of our clinicians who was at the Farm Progress Days with us from Eau Claire, she was in Eau Claire, and this was in Marshfield, was Deb Cron. And she was on for several hours over the course of the 3 days, and we were simply just looking for people who wanted to stop smoking or had questions about stop smoking. And it was incredible. There were over 100,000 people there. I think probably 50,000 of them came by our booth, and we only found one person who smoked. What was also interesting is the kids. You know, we kind of tried to kid around with the teenagers and the junior high kids, and it was clearly evident that they were not ever considering smoking, which we found refreshing. So I hope that this has been helpful to you today in terms of identifying ways that you can leverage yourselves through telehealth and a more effective outreach by reaching out to a greater and larger population and geographic area by using the virtual space, staying put, and doing more. Thank you very much. I think I'll take questions now.
Thank you so much, Dr. Antonetti. You provided us with a lot of rich information about telehealth and effective outreach strategies. This is Marisha speaking, and I do have a question for you, just to kind of kick things off. So if one of us wanted to go ahead and start and implement telehealth outreach, what would be 3 of your top tips that you would give us as we start our journey?
3 top hints on how to be successful?
Right, top tips, or 3 things that we just have to do if we're going to be successful with this.
Okay, good. Yes. The first thing is to really go someplace and see how it's done. If you've not done it before, we'd be glad to host you at Marshfield Clinic. Come up and see how it's done. And then we would sit down and look at your organizational structure, your practice, who you want to reach out to, and to just develop an action plan on how to get there. The second thing I would encourage is don't make this harder than it is. Doing telehealth is actually quite simple. It's really not difficult to do. So again, don't overthink it. There are a series of questions you need to answer for yourself, and once those questions are answered, then you should be good to go. And then the third is really have an effective program for managing your performance over telehealth, making sure that your clients and patients are satisfied. So have a patient satisfaction. If you're going to be working on helping others get started, making sure that they're satisfied with the program you're developing, and really just make sure that you practice according to your own clinical standards and of excellence, and you'll be just fine.
Thank you. So if anyone else has a question, you can go ahead and raise your hand, and I'll introduce you, and we'll have you unmuted. Okay, well, again, thank you so much, Doctor. We appreciate you taking your time to be with us today and presenting us with some really rich information that we can take back to our communities.
All right, thank you very much.
You're welcome. So I'm going to just bring up one slide, and we are going to wrap up. So just a couple quick announcements. I do want to let you all know that our next webinar within our series will be on November 2nd, and we are excited about having the National African American Tobacco Prevention Network support us in that webinar by providing a speaker. I also want to let you all know that we are on Facebook. Please like the Wisconsin Tobacco Prevention and Poverty Network on Facebook so that you can stay connected with us and we can keep you up to date on what we're doing. I hope that you all enjoyed the presentation and that you can take the information back to your communities so that you can implement it and reach out to people that you would not otherwise be able to reach. Thank you again for joining us, and we hope that you enjoy the rest of your day.